So our next presenter is Moshe Weinstein, CEO of Everads Therapy. Everads is a company focused on optimizing the treatment of retinal disease using its novel suprachoroidal delivery technology.
Thank you, Donna, for the introduction, and thank you for the opportunity here to present. So what is the suprachoroidal space, and why has this become a hot topic in retina? I'm pretty sure at the OAS 3 years ago, the word wasn't even mentioned, and here, now this is the second time you're hearing it today. So the suprachoroidal space, as some of you may know, especially if you've focused on retina, is the space between the sclera and the choroid, including the extravascular space of the choroid itself, and circumferentially spans the posterior segment of the eye. It's often referred to as a potential space because it only expands when fluid or drug are put into it. Now, why is this interesting, and why has this been the focus in Congresses, especially when it's discussion around gene therapy? First is delivery via this route of administration has the potential, or it directly targets the outer retina and choroid. The unique biodistribution profile of this compartment of the eye has a potential to offer extended durability. When you inject via this route, it doesn't interfere with the visual axis. Especially when we talk about gene therapy, it has the potential to be less immunogenic than other routes of administration. And the ability to do this in a quick and simple office-based procedure has increased a lot of interest here. Now, if a few years ago there wouldn't be any programs that are looking at this route of administration, right now what we've seen over the last 5 years is the first approval of a device-drug combination for suprachoroidal administration of triamcinolone. But you have a number of programs right now in the clinic who are studying suprachoroidal delivery, the most exciting of which is probably the AbbVie program looking at an anti-VEGF one-time injection with suprachoroidal delivery. There are also a number of companies who have come out and disclosed that they're a preclinical pipeline looking at this route of administration. Now, what's held up this area is the fact that you need a delivery technology. And 3 players dominate this field. I'm going to show you an image that I was at a Congress a few months ago and saw somebody from a big pharma get up and present this slide of the 3 players that dominate the suprachoroidal field, and Everads, us, is one of them. Now, I don't have the time to go through the differentiation between us and the other platforms, but I would say is that our differentiation has led us to be able to collaborate and sign license agreements as well as collaborations with no less than 5 companies. So what is our technology and how does it work? So this is what our injector looks like. It's a single-use injector that works with a disposable standard Lurlock syringe. And the heart of it is in the technology. And the concept of the invention, which we licensed in from Sheba, from Professor Yigal Rotenstreich, was to create a channel from the sclera into the choroid via blunt dissection, using what we call a tissue separator. And you can see here a cartoon illustrating our tangential injection into the eye, and that tissue separator extending and retracting, creating a channel from the sclera into the choroid, and then we're able to inject, and we see an immediate rapid distribution throughout the entire posterior segment of the eye. When we train physicians, right, this is what the procedure looks like in a human setting, in a clinical setting, and not that dissimilar from an intravitreal injection. A physician would measure with a caliper and then enter the eye. We've got a stopper that controls the entry of the needle into the eye. The physician pushes the device in, pushes down on the button to extend and retract the separator, and then pushes down on the plunger in order to deliver the drug or test article. Now, we often, after training, use either thermal imaging or sometimes dissect the eye and then peel back the retina and the choroid. Here was an example we were injecting in a pig eye, 150 microliter of ICG, and you can see here the distribution that's achieved with this approach. Now, since we last presented to you guys at OIS Israel 18 months ago, we've had a number of achievements. I can tell you that our technology has been used now to deliver therapies in over 200 non-human primate eyes in various collaborations. We're currently part of a GLP tox study for gene therapy. We've demonstrated macular RPE transduction in AAVs and non-human primates, which will be the focus of 2 ARVO posters. And notably, there are no procedure-related issues with our approach. We've also done multiple studies, both in the rabbit and mini pig, PK studies and biodistribution studies with our collaborators, showing the viability of this delivery approach. The technology has been the focus of a number of recent posters, publications, and presentations, some of which you'll see for those of you who are going to ARVO. On the business side, the most exciting thing that we've had is that we signed a license deal with Korea Therapeutics, a leading gene therapy company, where we received an upfront payment as well as the possibility for future milestones and royalties of their final gene therapy product. But we gave them just a limited exclusivity for a therapeutic target using gene therapy. This gives us the opportunity to partner with others, and we have 2 other undisclosed agreements with big pharma companies who have also paid us for certain exclusivities in order to use our technology. And there are others pending. Of course, we also have a co-development collaboration that we've disclosed with VivaVision where we're working on a small molecule for our internal pipeline. But the most exciting part for us right now and for the development of this technology is the fact that we just opened up our clinical trial. So the study and the objective of the study is to validate the injector safety and functionality and support the IND submissions of our collaborators. The study is a study titled Everads Injector and Suprachoroidal Administration of Triamcinolone for the treatment of patients with diabetic macular edema. It's being done at Rambam here, and the principal investigator is Dr. Yoreh Barak. On the business side, we continue our strategy to maximize our collaborations, but also to maximize the potential of this technology and develop our own pipeline. Once we have our first-in-human results, we will be starting our pre-series financing in order to help move the company forward and do proof of concept on our internal pipeline molecules. If you want to hear more, we're here in the room. Thank you to hear me and the team here for helping us, and looking forward to speaking.